Good morning. Welcome to the League of Women Voters at the La Crosse area's February No Lunch and Learn. I am Mary Nugent, La Crosse League's president. What a difference a year makes. Last February, at our Lunch and Learn, we celebrated the League's 100th anniversary with cookies and suffragettes all dressed up and a history lesson. I find it so inspirational that this February, while we can't physically get together, we're still meeting, learning, and advocating for human rights. Much has happened on the government scene in the past month that impacts these rights. On January 28th, President Biden issued two executive orders that impacts today's topic of women's health. The first order reopened the Affordable Care Act's enrollment from February 15th to May 15th to get Americans access to affordable health insurance. The second protects and expands access to comprehensive reproductive health care, both here and abroad. The League of Women Voters applauds these steps. In the 1980s, the League adopted a policy that states every U.S. resident should have access to affordable, quality health care, including birth control and the right to make reproductive choices. These are rights that are worth fighting for. Today, we are fortunate to have Courtney Hayward, Government Relations Specialist at Planned Parenthood Advocates of Wisconsin, to address women's health issues here in Wisconsin. Before I introduce Courtney, some reminders. As always, this webinar will be recorded and available on our website and on our YouTube channel. The League is proud to be nonpartisan, neither supporting nor opposing candidates or political parties at any level of government, but always working on the vital issues of concern to members and the public. Deb Luchin, previous League president, will be conducting the Q&A for Courtney. If you have questions, please submit them using the Q&A icon that's located on the bottom of your screen. Your questions will be addressed at the end of the speaker's presentation as time allows. We won't be monitoring the chat function for questions. Courtney Hayward has been the Government Relations Specialist at Planned Parenthood Advocates of Wisconsin for over a year. Courtney has a BA in Legal Studies, a Master's in Public Administration, and is currently finishing up her PhD in Public Policy and Administration. This past year, Courtney worked to get state legislators elected who would keep a woman's right to choose at the forefront of their legislative agenda, and is here to discuss the state of reproductive policy in Wisconsin. I'm so pleased to introduce Courtney Hayward.
Hello, and thank you guys for having me. I'm going to share my screen now so that I can begin my presentation. Okay, so today I'm going to be discussing the state of abortion access in Wisconsin, but also some other issues surrounding abortion access and healthcare. Sorry. So a little bit about me. Like Mary said, my name is Courtney Hayward. I am the Government Relations Specialist here at Planned Parenthood Advocates of Wisconsin. She already told you guys my credentials. I'm finishing up my doctorate so that I can earn my PhD in public policy. I have a background in fundraising and grants, which was a lot of, it provided a lot of transferable skills. So even though I've only been in this role for about a year at Planned Parenthood, I kind of jumped right in, feet first, into making connections with state legislators and other local officials in order to help us move our agenda forward. I am a Florida native. I've been in Wisconsin for about 4 years now, and I don't love the state. I don't hate the state either. I find it a bit odd in a lot of ways, but I'm adjusting, specifically to the cold. I also mentor at-risk youth. I started off mentoring one at-risk youth, and then she had some friends that she wanted to bring along. So now I currently mentor three of them. And they are all graduating seniors who are applying for and deciding what their college plans are. I am also passionate about advocacy and serving my community. So pre-pandemic, I did a lot of community service projects, especially with my teenagers. And now post-pandemic, or during the pandemic, I just sit on a lot of board of directors of nonprofit organizations that are based out of Madison and abroad. So today I am representing Planned Parenthood Advocates of Wisconsin. So we are essentially the electoral arm or the C4 arm of Planned Parenthood of Wisconsin. We do all of the advocacy and election outreach work for the organization. We also do the lobbying and organizing work for the organization. So I am one of two registered lobbyists for Planned Parenthood Advocates of Wisconsin. My boss is Mike Murray, is the other registered lobbyist, but I do all of the lobbying at the state and local level for the organization. In addition, I also oversee or manage our endorsement process. So, like Mary mentioned in the beginning, I worked last year in order to help get candidates elected that are going to help us move our mission forward and who are pro reproductive health care rights. So our issues at Planned Parenthood extend beyond reproductive health care. We care about things such as healthcare access and all of the things that affect our patients. So we see a lot of patients who are low income or people of color who don't have I guess the American dream, so to speak. And so we advocate to make sure that they have access to the things that they need in order to live productive lives. And sometimes that include election and voter access protection. So we know that at the federal level, since the Republicans lost the House, the Senate, and the presidency, at the state level, we anticipate that there are going to be some laws being passed that will try to restrict voter access. And so Planned Parenthood advocates, we do things like advocate for protections for voter access in this state. We also advocate for reproductive and social justice issues, environmental justice issues, as well as LGBTQ rights and racial equity issues. So today's topics, we're going to talk about a myriad of things. And so if it seems like a lot of information and you have questions that you're not able to ask during the session, Mary has my contact information, so feel free to reach out to me afterwards. But today's topics are going to be Ruth Bader Ginsburg and Amy Coney Barrett and what they mean to reproductive health care. There are currently 17 cases that potentially impact abortion access that are one step away from the Supreme Court. We'll also discuss abortion access restrictions in Wisconsin and other states, and also the impact of abortion restrictions on people of color and low-income folks. And then we will talk about the Wisconsin 1849 criminal abortion law and what it means if Roe v. Wade is overturned. And finally, we will discuss the Abortion Access Protection Act / the Abortion Rights Preservation Act, which is a response to what will happen if Roe v. Wade is overturned. So, Justice Ruth Bader Ginsburg. Her death was such a profound thing that happened in this nation, and it definitely impacted organizations like Planned Parenthood. I remember being on a call with the governor's office and not really paying attention when I found out that she had passed away, and just remember thinking that things are about to change. And for us, nothing has like drastically changed as of yet, but we anticipate there are going to be some changes or some challenges coming down the road with her passing. In her 27 years, Justice Ginsburg was a reliable champion for reproductive rights. We knew without a shadow of a doubt that like if there were issues that came to the Supreme Court surrounding reproductive health care or abortion access, that we knew she was going to vote our way no matter what. And we appreciated that about her. One of the things that I appreciated about her was that she framed abortion issues as one of women's autonomy and equity. She believed in a woman's right to have bodily autonomy. And that's rare for someone in the legal field, especially in today's society. Some of her most notable cases include the June Medical Services versus Russo. And this was the Louisiana case that put abortion access in jeopardy last year. It was ruled unconstitutional, and that kept a lot of abortion care providers on edge because we didn't know how that case was going to go. Um, they ended up ruling in our favor, but she reiterated that that law imposed severe burdens on pregnant people for no legitimate medical reasons. And then there was another case, the Trump versus Pennsylvania, which allows companies and organizations with religious or moral objections to opt out of covering birth control or abortion coverage. That is currently in law. Currently, the in law right now, like the companies can deny coverage for abortion or birth control. She was one of three justices that dissented. And it was probably one of her last cases that she ended up dissenting on. I just wanted to note about her, though, that the last two Supreme Court cases on abortion restrictions were decided by one vote while Justice Ginsburg was on the court. So she essentially saved Roe. And with her gone, we are a bit nervous about what's going to happen in the future as it pertains to abortion access in this country. And then we got Justice Amy Coney Barrett. So as you know, you may already know, she was the most recent Trump appointee to the Supreme Court. She is a threat to abortion access because she has referred to abortion access is abortion as always immoral. She's a vocal pro-lifer and a conservative. She even dissented on a case in Indiana in favor of requiring abortion providers to notify parents of minors seeking abortion. With Barrett on the court, Republicans now have appointed 6 of the 9 current justices. So there's only 3 liberal justices on the Supreme Court at the moment. The 17 cases that threaten abortion access. So right now, abortion access in this country is hanging on by a thread, and for too many people. However, nearly 80% of Americans believe that abortion should remain legal. The Supreme Court has yet to decide or announce whether it will hear arguments for 2 abortion cases that have reached the high courts. One of those are in Mississippi, which is a 15-week abortion ban. So in Mississippi, you can't have an abortion after 15 weeks, but nationally, a person can have an abortion up to 24 weeks. The other case is the challenge that from the Trump administration that don't allow abortion care providers to receive federal funds. So again, the Supreme Court hasn't decided yet whether or not it'll hear those cases, and Planned Parenthood and organizations like us are waiting to see if a decision will be made on whether or not they will hear those cases. So among the 17 cases that have already reached the appellate courts, which is like the step below the Supreme Court, 5 would ban abortions at various points in the person's pregnancy. In North Carolina, they have a 20-week ban. I think in the last few weeks, they reduced that to about 18 weeks. I'm not sure what the numbers are. In Arkansas, it's 18-week ban. Missouri has 8. And Georgia has probably the most restrictive abortion ban law, and that's 6 weeks. Tennessee has bans that at various points, and it just really depends on the nature of why a person is trying to get an abortion. The other cases that could potentially make it to the Supreme Court center on various abortion regulations that severely restrict the patient's access to the procedure, which include parental notification laws, requirements of providers, such as requiring that providers have certain licenses, that some of them that may be too expensive for some to acquire, and then restrictions on specific termination methods, such as medical abortions. So what will happen if Roe is overturned? If Roe is overturned, it will not automatically ban abortions in the United States. So I know a lot of people, when they hear that, they're like, oh my gosh, Roe is in jeopardy. That means that abortions will be illegal in this country. That's not what it means. It means that abortion access will then be left to the states. Right now, 9 states, including Wisconsin, have trigger laws in place that will criminalize abortions if Roe is overturned. Abortions will become partially illegal in 22 other states, which means people will have to travel further to get abortion care. Studies show that as distance to clinics increases, abortion rates decline. Which cases will the go to Supreme Court ultimately hear? Well, it's impossible to predict that because 4 justices need to agree in order for the High Court to add the case to its docket. Typically, the Supreme Court doesn't get involved unless the lower courts disagree. So, abortion access restrictions, what states have done in order to limit the amount of abortions in their states because they can't just criminalize it or make it illegal, they provide undue barriers for people to access abortion. So, one of them being gestational bans, meaning they ban abortions after a certain point in the pregnancy. Method bans are another way to restrict access, and methods, like I said, such as medical AB, and that's when someone gets doesn't get a physical abortion. They take a pill in order to eliminate the pregnancy. They also do things such as medically unnecessary requirements, such as waiting periods and bias counseling. We have those here in Wisconsin, and I'll talk about those a little bit later. And then there's also parental involvement laws that require parental consent or notification or judicial approval for minors to seek abortion care. And then these so-called born alive laws, which require medical care for fetuses after an unsuccessful abortion, which is kind of weird in and of itself. But it could be traumatizing to a a pregnant woman or a person who's decided to end her pregnancy if she has to bury her fetus. There are also like trap laws or targeted restrictions of abortion provider laws, which place medically unnecessary requirements on clinics. So they might say, the laws might say that an abortion clinic has to meet certain standards that other health centers don't. And it's unfair, and it's just another way to provide barriers for providing abortion care. And then there are the trigger bans that put laws on the books in states to ban abortion if Roe is overturned. So let's talk about abortion access and people of color for a second. Um, I found this quote on the internet and I wholeheartedly agree with this. And it says, for many Black women, abortions are as much of an act of love as bringing a child into this world and raising it could ever be. Um, I want bodily autonomy as a Black woman, and I know so many other people of color that believe in the same thing. And having access to abortion care will allow me to decide when I decide to start a family. So one of the issues that help promote or hinder people of color from receiving abortion care is explicit racism and false narratives. I've seen this sign in other places all over the internet. People share it, and I've gotten into disagreements with people about it. And it's basically anti-abortion organizations targeting Black and Latino women with false and harmful rhetoric. So, abortion access for people of color. Many people of color already live in a reality where they don't have true access to affordable abortion care. Due to factors such as structural racism and discrimination, women of color face rampant income inequalities and are more likely to be covered by Medicaid as a result. Well, Medicaid currently does not cover abortion access. And they are therefore disproportionately impacted by the Hyde Amendment, which again bans federal funds for providing abortion care. Similarly, funding restrictions limit the ability of Native Americans who receive care through the Indian Health Services from accessing abortion. So the Indian Healthcare Service, you cannot use those funds to get an abortion. I wanted to note that women of color access to abortion care is even more critical when considering the pervasive health disparities they face in comparison to white women, especially in Wisconsin. Infant and maternal mortality in Wisconsin is the worst in the nation. In nearly all aspects of reproductive health, women of color face poorer health outcomes than white women, from maternal mortality rates to endometrial and cervical cancer. Black women frequently have negative experience in the healthcare systems due to institutionalized racism and a history of control, coercion, and a lack of bodily autonomy when it comes to their reproductive health and decision making. I can tell you personally, when I moved to Wisconsin, my family was a little bit hesitant about me moving here because they were concerned about the health disparities in this state. I have not had a Black doctor or a person of color as a physician since I moved here because they're kind of rare. And I've also read studies that physicians have these weird beliefs about Black patients. And one of the weirdest beliefs that I saw most recently was that 30% of white physicians believe that Black people can handle pain better than, or more pain than white people. So knowing that is a hindrance for me. So it almost is like I don't want to go see a physician because of that, which could be detrimental to my health. The promises of Roe and people of color. Let's talk about that for a second. So before Roe, middle-class white women led the charge to help fellow white women access abortion. For years before abortion was legal, groups of Groups such as the Jane Collective formed as secret societies organizing around abortion rights, helping white women attain abortions from trained providers. Black women had abortions largely unsafe before Roe II. However, unlike white women, Black women were largely invisible to mainstream groups organizing around abortion access and rights. Those reasons include Black women's lack of financial resources, social connections to abortion providers, and the stigma around Black abortions in the Black community at the time. Abortion can be cost prohibitive for any woman who lacks insurance coverage for the procedure or the financial ability to pay out of pocket. So a lot of insurance companies today don't cover abortion access. Or abortion coverage. So women of color who don't have the financial means to pay for abortions are now having more unwanted pregnancies. Black women are dying at 3 to 4 times the rate of white women during pregnancy due to pregnancy related issues. Both Black women and Latinas experience higher rates of unintended pregnancies than white counterparts. Cultural issues, stereotypes, and fear can cause Asian and Pacific Island women to forego reproductive health care. All of these were components of what Roe was supposed to help women gain access to, but women of color are excluded from those things. Wisconsin abortion laws and restrictions. So what's happening here in Wisconsin? First of all, a patient must receive state-directed counseling, and that includes information designed to discourage a patient from having abortions, and then wait 24 hours before the procedure is provided. So they have to come in to a health clinic or health center, get counseling, talk about the abortion. Then they have to wait and come back in 24 hours before they can actually have the procedure. Badger care will only cover abortions in cases of life endangerment or severely compromised physical health, or in some limited cases of rape and incest. The use of telemedicine to administer medical abortion is prohibited. So a person can't, Planned Parenthood, for example, we can't mail a person pills for a medical abortion and then use telemedical medicine in order to counsel them through. They have to physically come in for an abortion, period, no matter what procedure they decide to use. And in Wisconsin, a parent of a minor must consent before an abortion. I volunteered doing like health screenings at our health center, and they check IDs to make sure that whoever comes into our abortion clinics are of age in order to receive abortion, unless they have a parent with them. Also in Wisconsin, a patient must go in ultrasound before obtaining an abortion. This can be traumatic for women. So if you come in and you're like thinking about just ending the pregnancy, a lot of times women have a detachment away from the the fetus that's growing in their body. Showing them a visual image of something growing in their bodies might discourage them, and now they are in turn having like this unwanted pregnancy. An abortion may be performed up to 20 weeks post fertilization and 22 weeks after the last menstrual cycle in Wisconsin. So, as I mentioned before, Wisconsin is one of 9 states with an archaic criminalization statute still on the books. 48 years after Roe was made, the statute, even after 48 years, Roe made the statute unenforceable. In 1849, the state legislature passed a law that criminalized abortions, making it a felony for a doctor to perform an abortion on a woman, no matter the circumstance of her pregnancy. The unfortunate part of this is that the law was never repealed successfully. Personhood bills. So one of like my first assignments as a lobbyist here at Planned Parenthood was I had to sit through a personhood bill committee hearing. And it's basically a bill that has been introduced in the last few legislative sessions. Andre Jacques always introduces these bills, and basically it gives a fertilized egg the same rights and privileges as a fully formed adult. This puts doctors in a very difficult situation because if a doctor is in a position where it's a life or death of the parent, it's if it's a save the life of the mother or save the life of the child, what do they do if the child had or if the fetus has the same rights as the mother? Do they wait for the courts to decide or what? And so a lot of doctors have testified at these hearings saying that these bills are detrimental to their careers and it puts them in very bad situations. The good thing about it is that these personhood bills have been unsuccessful only because our governor vetoes the bills or they don't have enough support in the House and the Senate to get them passed. So the Abortion Access Protection Act and the Abortion Rights Preservation Act, these are the bills that will repeal the Wisconsin criminal abortion law in the event that Roe is overturned. These bills have been introduced twice, but the Republicans refuse to take them up or do anything with them. They will get assigned a bill number, but a lot of times they won't even make it to a committee hearing. The Abortion Rights Preservation Act was most recently introduced in January 2021 on the anniversary of Roe, and at the moment, there has not been any movement on it yet, and the Republicans don't plan to make any movement on it. So, what can you do? Educate yourself more on the laws and abortion restrictions in Wisconsin. There's a lot of information, a lot of articles. We subscribe to WIS Politics, and they're always sending out information concerning what's coming down the pike as it relates to these issues. And so there's a lot of information. Educate yourself, see what's going on. If this issue is important to you, read, watch the news, subscribe to YouTube channels, and then click on Planned Parenthood Advocates of Wisconsin's website. We are constantly updating that with information. And then volunteer with organizations like Planned Parenthood Advocates of Wisconsin in order to raise awareness about these issues. We have an organizing team in La Crosse. Carol Lee Behringer is our lead organizer up there, and she's phenomenal. She works with our public affairs department to help get the word out about what's going on. If there's some calls to actions to state senators or state representatives in order to tell them to vote against or to support certain bills that could restrict abortion access, she will have that information for you. She also is involved in like our email messaging, our Facebook messaging, and our text messaging campaigns that we do. So reach out to either her or reach out to anyone of Planned Parenthood Advocates of Wisconsin, and we'll connect you with someone who can help you get involved. And then just when you hear about these issues that come about, just call or email your state representatives and tell them to act on, or that you support the Abortion Rights Protection Act. That is the most recent bill that seeks to repeal the criminal abortion ban in the event that Roe is overturned. But right now, it doesn't have a lot of support. So we need people like you guys to do a call to action. We will be doing more work surrounding this probably in the spring to educate you guys on what to say when you call them. But in the meantime, just keep an eye on for any information regarding these issues. Any questions?
Thank you. We do have a couple of questions for
Okay.
you. The first one is, you mentioned that Wisconsin has the worst infant and mortality rates in the country. And could you talk about that a little bit more and maybe share with us what can be done about that?
Yes. So for Black women specifically, Wisconsin has the worst infant and maternal mortality rates in the country. That could be due to a variety of factors. One, a lot of Black women just don't seek care right away when they're starting to have issues, and that could be due to like economics or just not having transportation to gain access to get to a doctor's office. And then it's a big part of that that research is starting to show is that a lot of these physicians do not adequately know how to treat these patients. So a Black woman can go into a hospital or an urgent care and say, I'm having pain. And they will say, oh, it's just this. And then send them about their way. And then 6 hours later, they're hemorrhaging or something that's happened with the pregnancy and now they're gone. And so those are like just examples of why it happens. We are currently working on a few bill package called the Momnibus bill, and it's basically at the federal level. They are a group of Black legislators at the federal level has gotten together to create this bill package that addresses these health disparities in the Black community. It deals with economics, it deals with environmental issues, it deals with abortion access and things of that nature. And so Wisconsin or the group of Black-led organizations that Planned Parenthood is working with now is trying to create a similar bill package that we can introduce to state legislature. In order to help them to get a move on some of those issues. Now, we won't be introducing that until the fall, but you'll start hearing about what we're doing as an organization probably around midsummer. So you can get involved. And once you start seeing information about that, that's when you can start acting and getting involved and volunteering with Planned Parenthood to get the word out about what we're trying to do to help address those disparities.
Thank you. Where are the abortion providers located in the state of Wisconsin?
Well, I don't know about like all of them, but I could tell you in Planned Parenthood, we have 3 of them. So Planned Parenthood has 24 health centers. Only 3 of them provide abortions. We have one here in Madison, we have one in Milwaukee, and then I believe the other one is somewhere around Green Bay.
Just to clarify, because you commented that we should advocate for the ARPA, and is that the Abortion Rights Preservation Act that you referred to?
Yes.
Okay.
It's essentially the same bill as the Abortion Access Protection Act. It was just introduced by different legislators this time.
So that's what it's referred to. That's the title this
Yes.
year, the
Mm-hmm.
Abortion Rights Preservation Act. Okay, so in Wisconsin, if Roe was repealed and the old law remains on the books from, I think you said 1849, was that it?
Mm-hmm. Yep.
Who would be arrested, the women or the physicians?
The physicians. And I think there is something in that statute that say that the women will be fined or something like that, but it's the physicians that will be arrested.
So another question is, you just commented that Planned Parenthood has sites throughout the state, and that really only 3 of them are where there are direct abortion services available. Is that what I understood? Could you
Yes.
just maybe highlight, because if we think about women's health, you said that Planned Parenthood is a really important source of healthcare for low-income women. Could you maybe just overview the scope of care by Planned Parenthood?
Yes. So when I started here, I thought like a lot of people, Planned Parenthood is the abortion clinic, right? But we do so much more than that. And again, like only 97% of what we do is not abortions. We do breast exam, we screen for STI testing, we do cervical cancer screenings, we provide health education to teenagers, we provide free condoms. And we do a lot of that. At no cost to some of our patients. So people will come in. So we have a our mission is, or one of our logos or slogans, sorry, is care no matter what. You can come into a Planned Parenthood and not have health insurance, and we will still see you. We treat everybody the same, no matter what your economic status is. And so there have been times when a patient will come into Planned Parenthood and say, I think I have an STI, or I think I have a yeast infection or something like that. And we will see them and we will talk about payment after the fact. And if they say, well, let's make an arrangement and I can pay you for this sometime later, and we might not ever see that patient again. We absorb that cost. That's why we have like fundraisers and stuff like that, so that we can absorb that cost. We also, if you go into our health center, when we're talking about payment, if we see that you qualify for Badger Care, we have people on staff that will help you sign up for Badger Care. So again, we don't just focus on like, oh, we need to treat you because we need to get paid. It's when people come into our centers, they have issues, health issues, we address them. Sometimes we've even had patients come in with like diabetic issues and stuff like that, that our physicians have noticed. Now, we don't necessarily treat them or write prescriptions for them, but we do recommend that they see certain facilities, and we typically send them to facilities that we know will be at no cost or very little cost to them.
So you're kind of you just talked about the range of services, and you identified where abortions. So um, can you provide a little more information about variations in local access to abortion services?
I'm not really familiar with La Crosse because I think I've only been there once, so I'm not exactly sure what services they provide there. I know that it's our family planning services, that's what they call it, that we have in La Crosse. And all of this information can be found on our website at PlannedParenthoodofWisconsin.com.
Okay, thinking of contacting legislators, if legislative districts are sort of echo chambers, how does contacting legislators support reproductive rights? Are you finding legislators really listen to you or would listen to us?
Yeah, well, so I find that legislators listen to people, they listen to their constituents, like they want you to vote for them, but they listen to constituents more when they're connected to a larger organization who has a further reach. So Republicans don't like us. When I walk into the Capitol before the pandemic was here, Republicans will look at me as a threat. They're like, uh-oh, she represents Planned Parenthood, because they know that we have the ability to make their lives very difficult. If they say or do something to a constituent or to a supporter of ours, we can basically blast them on social media and other outlets to make their reputation not so great. And so, yes, will they listen to you? Yeah. But if you're connected to a larger organization like Planned Parenthood, they are more likely to listen to you and act, because they know that you have the support of a large organization like Planned Parenthood behind you.
Have there been any movement legislatively to restrict access to birth control in Wisconsin?
Not that I know of, but I can get back with you on that. I know that at the Supreme Court level, there was some movement recently, but I don't have all of the details surrounding that. But as of lately, I don't think anything regarding birth control specifically in Wisconsin has gotten through anywhere.
So kind of taking a little different approach to thinking about access to birth control. Has there any effort to make birth control over the counter?
Yes, so that was one of the fights that we were trying to take up before I got here. And I remember reading a lot of information when I first got here about that. Um, but we have weird politicians who believe that um, birth control is population control. So anytime we try to introduce things like that, they shut it down.
So you talked about the overwhelming majority of care provided through Planned Parenthood is health care and health prevention. And so what percentage of funding from Planned Parenthood goes towards abortion? Because there's a lot of focus on funding you because of abortion, but what percentage of funding do you know goes towards abortion care?
I don't know that answer, but I can take that to my supervisor. He might know.
Okay. Are there any other questions? So that's the questions that we have so far. Is there any other comments you'd like to make, Courtney, as we kind of finish up the discussion?
Nope. Thank you guys for having me here.
Oh, Deb, there's one more question.
Oh, okay.
Okay.
Oh, I see. Oh, okay. I missed that one. Okay. All right. Here's another question. I hadn't scrolled down fast enough. Could you expand a bit more on the intersectionality of reproductive rights and population control?
Okay, reproductive rights and population control. I don't know that I can. I don't know that I have an explanation for that. But I do know that, like, I've heard that, I've read that and heard it from legislators themselves that say if you, especially in the North, right, if you bring birth control to the North, that means less people will be having babies up North. And so that means less population up North. Does it make a whole lot of sense? No. But that's the explanation that they have given to me. I hope that answers your question.
And we have another person who said, very informative. Thank you.
Thank you.
Okay, Mary, are you ready to move on here?
Sure.
Okay, just a second. Let me get to the right place.
Thank you, Courtney, and thank you, Deb. Awareness of how legislation affects not only women's reproductive health, but also other health issues such as domestic violence, maternal care, and access to insurance is very empowering. If you're interested in becoming involved in this topic, you're invited to become part of the League of Women Voters Wisconsin Legislative Committee's Health Portfolio Working Group by contact us in our Gmail, and I will send you the information that you need in order to contact the people in that group. A reminder that getting involved in the league is a great way to meet interesting people and um, and to help out your community. I'm going to share some of the things that are coming up in the next month or two that you could be interested in joining. We had the spring. Everyone should vote in February, on February 16th. There's as you can see, there's a community conversations um, meeting, and that's always at noon. Again, look on the website or or on Google to find out about these things. And next month, International Women's Day. Our our legislative breakfast that we usually have is we are going to be doing it, but of course it's not going to be a breakfast. So keep watching for more information on that. Please consider volunteering for one of our standing or temporary committees. These include Vote 411, candidate forums, the Oral History Project, ranked choice voting, infrastructure, clean water, and redistricting. Check out the website for these opportunities and for more. Also, thank you for those who took the time to complete the membership survey. That was for League of Women Voters Wisconsin. Your replies will help determine the direction of that the Wisconsin League takes. Thank you everyone for attending our webinar on women's health legislation. If you have any further questions or comments, please send them to our Gmail account, which is lwvlawi@gmail. As always, our news updates is an excellent way to keep up to date with events in both the league and the community. If you miss it in your mailbox, you can find all that information and more on our website. And while you're at it, check us out on Facebook, Instagram, and Twitter. And finally, stay warm, stay well, and happy Valentine's Day. Goodbye and see you in March for International Women's Day. Thank you for coming.